My name is Gill Ashton and I'm a paediatric allergy dietitian. So in my role, I work alongside several consultants who have an interest in allergy, an allergy nurse consultant, an allergy nurse, other dietitians, and we form part of the allergy MDT team that do outpatient clinics. So I would be seeing patients once they've seen the consultant, had their history and their testing done, to give them advice about allergen avoidance, how to make sure that they're keeping the diet nutritionally balanced, making sure the child is growing well, and giving them advice around alternatives for where they're having to avoid things like milk and egg. I really enjoy my role and find it really rewarding because I feel like I'm making a real difference. Parents are really engaged, they want the best for their child, and they're really grateful for the advice and support that we give. Very often there's been quite a long road to them being diagnosed with an allergy, and we're the first team perhaps that has totally believed them and given them the advice and support that they need, and they verbalise regularly how grateful they are to all of us, and I find that really rewarding, and especially not having to just give negative advice about avoidance all the time. We can actively help them to reintroduce some allergens by using things like milk ladders and egg ladders, and parents are always really chuffed because they feel like they're making a difference to their child as well by doing these things. So the Trust is a lovely place to work. There's lots of benefits to working here. During the pandemic, they opened the Wellness Centre and I was able to take advantage of the things they were offering there. So I went and had a nice back massage. We've got a great occupational health team that you can be referred to if it's needed. And I have used things like the counselling service in the past, and that's been really great. My immediate team, which is the other paediatric dietitians, are great. There's only a few of us, but we're very close and we work well together. Everyone's a real team player and very supportive. But the wider dietetic department, so the adults team and the community team, are all lovely. We all get on very well, and it's nice place to work, very friendly, and everyone's very supportive. And then I work as a wider team with the consultants and the nurses, and again the allergy team, fantastic, lots of support there, and just a really nice place to learn, lots of learning choices and experiences. So you might know that we've got a new hospital being built, the Midland Met, and hopefully will be opening in 2023, which should see all our services end up on one site. In paediatrics, we've got a whole floor in the hospital which incorporates the inpatient, the wards. So in terms of communicating between teams, it's going to be beneficial for us, definitely, and I think we'll make it much more smooth in terms of handover and that kind of thing. I do enjoy my job. The part of my job that I enjoy the most is the patient work. I love interacting with children and their parents. I find it really, really rewarding, and my passion is allergy. I've been doing it just solely allergy for 4 years now, and the opportunity came up 4 years ago for me to just specialise into allergy, and I love it, and I love coming to work and seeing the patients and really making a difference.